The medical termination of pregnancy kit, that is Ectopic kit, is a widely used and medically approved method for terminating early pregnancies. It contains two essential medications, mifepristone and misoprostrol, which work together to end a pregnancy safely and effectively. Mifepristone blocks the hormone progesterone, which is necessary for maintaining pregnancy, while misoprostol induces uterine contractions to expel the pregnancy tissue. When taken correctly, the Ectopic kit typically causes bleeding and cramping, which are signs that the abortion process is underway. However, some women may experience little to no bleeding after taking the medications, leading to concerns about the effectiveness of the procedure and potential complications. Understanding the reasons behind the absence of bleeding and exploring possible solutions can help women navigate this situation with clarity and confidence. Bleeding is expected after using the Ectopic kit, usually beginning within a few hours to a couple of days after taking misoprostol. The bleeding is often heavier than a normal period and may be accompanied by blood clots, which indicate the expulsion of pregnancy tissue. However, the intensity and duration of bleeding can vary from person to person. While some women may experience heavy bleeding immediately, others may have a delayed or lighter flow. The absence of bleeding altogether is unusual and may indicate an underlying issue that requires medical attention. One of the primary reasons for no bleeding after taking the Ectopic kit is an incomplete or failed abortion. In some cases, the medications may not work as intended, leading to a retained pregnancy or incomplete expulsion of pregnancy tissue. This can happen due to several factors, including incorrect doses, poor absorption of the medication, or individual variations in response to the drugs. If the pregnancy is not completely terminated, it may continue to develop, which can be confirmed through an ultrasound. In such cases, a doctor may recommend an additional dose of misoprostol or a surgical procedure such as dilatation and curettage, that is DNC, to ensure that the abortion is complete. Another possible reason for the absence of bleeding is delayed response to the medication. Some women's body may take longer to react to misoprostol, resulting in a delay in the onset of bleeding. In such cases, it is advisable to wait at least 48 hours before seeking medical intervention. If bleeding still does not occur, a follow-up consultation with a healthcare provider is necessary to assess the situation and determine the appropriate course of action. An ectopic pregnancy is another serious concern when bleeding does not occur after taking the Ectopic kit. An ectopic pregnancy happens when the fertilized egg implants outside the uterus, usually in the fallopian tubes. The Ectopic kit is only effective for terminating intrauterine pregnancies and does not work for ectopic pregnancies. If a woman does not experience bleeding and also has severe abdominal pain, dizziness, shoulder pain, or fainting, immediate medical attention is crucial. An untreated ectopic pregnancy can be life-threatening and requires urgent surgical or medical treatment. Hormonal imbalances and pre-existing medical conditions can also contribute to the absence of bleeding. Women with conditions such as polycystic ovary syndrome, that is PCOS, or thyroid disorders may have an altered hormonal response that affects how their body reacts to the Ectopic kit. Stress and anxiety can also play a role, as psychological factors can sometimes influence physical symptoms and delay the body's response to the medication. In such cases, a thorough medical evaluation is necessary to determine the cause and find an appropriate solution. When bleeding does not occur after using the Ectopic kit, it is essential to seek medical advice rather than assuming the abortion has failed. A doctor may recommend an ultrasound to check whether the pregnancy has been terminated or if there is retained product of conception that needs further treatment. If the abortion is incomplete, an additional dose of misoprostol may be given to stimulate uterine contractions. In cases where medical management is unsuccessful, a surgical process such as manual vacuum aspiration or DNC may be required to remove any remaining products of conception and prevent complications such as infection. Proper medical supervision and follow-up care are crucial when using the Ectopic kit to ensure a safe and successful abortion. Women who do not experience the expected bleeding should not panic but should consult a doctor as soon as possible. Taking the medication according to the prescribed instructions, maintaining open communication with the doctor, and undergoing necessary follow-up examinations can help ensure that the procedure is completed without complications. Medical abortion is a significant reproductive health choice, and understanding the potential challenges such as the absence of bleeding is essential for women women's well-being. While the MTP kit is generally effective, variations in individual response can lead to unexpected outcomes. Seeking timely medical intervention, undergoing necessary tests, and following appropriate treatment can help address concerns and ensure a safe termination. Raising awareness about medical abortion, its potential complications, and the importance of professional medical guidance can empower women to make informed decisions about their reproductive health.